Hey there, Dr. Brian McKay, Neuropathy of Core Health. Well, a lot of times the patients come in here are on for neuropathy care here are on a number of different medications. And the one medication that sticks out the most to me is statins. So I have a neuropathy patient who's not getting better and is got very, very low cholesterol levels, but now she happens to be on 10 medications, yes, 10. And her doctor felt it's important to protect her heart, prevent a stroke, that they put her on statins. Now, I'm not going to get the argument pro or con against statins in general, but you have to be aware there are increased risks of peripheral neuropathy. And I want to explain to you how the whole thing works. Your body needs cholesterol. It needs a certain amount of cholesterol. Just like if you have low cholesterol, people today think that's good. But I'm sure you've heard of hypotension, which is low blood pressure, as opposed to hypertension. You want to have that healthy range in the middle where you can really your body operates optimally. So her cholesterol is 140, which is very low. But again, her doctor insisted that she go on this medication because she was trying to protect her heart. So you have a well-intentioned doctor who's just not well-educated is really what it comes down to. And so is this person needlessly suffering from peripheral neuropathy? Uh, she can't feel her feet. Her balance is off. So when is enough medication enough medication? I mean, think about it. If you're on two medications, are you healthy? You may feel you're healthy. Or, people see these cholesterol commercials with overweight people say, I lowered my cholesterol. I lowered my A1C. But they're still overweight. They're not dieting. They're not exercising. They're relying on these numbers. And that's not based on fact. It's based on inference that, okay, I have a low cholesterol number. That means I'm not going to get a heart attack. There's no studies showing a reduced number of heart attacks. You have to understand the drug companies do the research. If, as a chiropractor, if I say I funded research that said all patients need chiropractic, what would the results come out? Yeah, all patients need chiropractic. So the results are skewed to say the least. But this thing about, statins, they're good for the brain. There's a substance that cholesterol produces, and we'll focus on that today so you get a better understanding. The substance is called myelin. Myelin is a protein that covers your nervous system. So you think of nerves, but I also want you to think about the brain. Okay? So the brain needs myelin. It allows for conductivity of the nerve impulses. The afferent nerve impulses are the ones that go to the brain. Efferent are the ones that are sent down from the motor for your output. And you need to have a certain amount of myelin to allow for smooth conductivity. You don't have the myelin, you don't have the conductivity. So if we're going to interfere with the body's ability to heal or to do its job efficiently in the name of prophylactic, good sense care for your heart, would the doctor be better advised to tell the patient to eat better? Probably. But the statin, so what I had to have the heart-to-heart conversation with this patient, say, listen, what I do here can't help you. You need to talk to your doctor and give this a try without taking the statins. I mean, one of the side effects people, talk about is not just muscle weakness, okay? And they'll allow, and if you read the fine print in the medications, rare side effects include muscle weakness, loss of sensation or tingling in the nerves of the hands and the feet. Now, rare, when everybody's on statin, the number of people for neuropathy is skyrocketing. I mean, understand this way: there's always an underlying condition that causes the neuropathy. Primarily, you have exposure to toxins. Say you had, a Vietnam vet and you're exposed to Agent Orange. It's logical that you will have some neuropathy from exposure. Another thing is people who drink way too much. The alcohol is a sugar. It's in the bloodstream, and it attacks the covering on the nerves and the brain as well. You have diabetics, again, with too much sugar dysregulation. that the sugar in the blood attacks the nerve covering, allowing for these pins and needles, loss of sensation, tingling in the nerve endings in the hands and feet. On top of that, people are exposed to chemotherapy. Now, understand, I'm not saying that the underlying, go off your diabetic medication, don't do chemotherapy. That's the front line. But when you add in that statin to further diminish your body's way to make cholesterol. Now, cholesterol is a needed substance in the body. It's like a hormone precursor, and it helps to produce hormones. Um, you know, these days, people, again, very unhealthy people, rather than trying to lower their cholesterol to a normal level, and I personally don't agree with the 200 number as the Bible these days. I think it should be better 240. But what happens is the drug companies are allowed to sell more medications. I mean, quite often people be on 2 cholesterol medications. And the topic of diet and exercise just doesn't come into play. So here we have people who are not being responsible for their own care. They're not responsible for themselves. Give me the medication. I have the neuropathy. Let me take the gabapentin, the Cymbalta, the Lyrica. So the last thing someone needs is another medication. I'm sure I've heard it a million times. Maybe you haven't, but we all know of someone, an older person, where they take off all their medications and then they thrive. Why? Because the body's trying to do what it wants to do. And when you interfere with it with 4, 5, 6 medications, now, if you think about it, you have a parent who's 75 or older. How many medications are they on? A high blood pressure? I'm not saying you don't take the high blood pressure medication. I'm not saying you don't take a statin, but when you start to develop side effects, because, and let's take these side effects to the diabetic world primarily. Diabetics have a loss of blood flow. The blood flow isn't what it needs to be. Now you got to stimulate that blood flow. You got to make sure the glucose regulation's in check, and you got to make sure there's enough oxygen going to the hands and the feet. The feet are usually worse than the hands because they're further away from the heart. So you got to get blood flow from that heart all the way down to your feet. And if the nerve is not sending that afferent signal back up properly, you're going to have a change in those types of nerves. And the nerves we're talking about, these we call them large diameter afferents. And they are, if you really want to know the names, Meissner's, Merkel's, Pacinian, and Ruffini nerves. And these 4 nerves provide sensory input to the brain, which then sends down a motor input to act on whatever the body's looking to do. So you're really messing with it. Now, another thing, too, is as far as the statins, think of it this way. You take this pill, and it lowers a number. It interferes with your liver's ability to produce cholesterol. And that's basically, in a nutshell, what a statin does. If you were a teacher and you had a bunch of dumb students, what would you do? You can grade them on a curve and everybody looks like a genius. So you have overweight people who aren't exercising, ranting about, I lowered my cholesterol. Isn't this great? Yes, but not really. It's really not as great as you would be led to believe, because your body needs cholesterol. So it's more of a common sense approach. And I get these questions. I get questions all the time. It's like, can statins cause foot neuropathy? Hell yes. The statins that don't cause neuropathy, I don't know of one that doesn't. How do they cause neuropathy? By interfering with the production of the cholesterol, which you need to produce the myelin sheath. Very important. I mean, let's get back to the diabetics. I'm going off topic for a second here. I'm speaking like Joe Biden. The diabetics, when they lose the blood flow, they lose nerve intervention, blood flow. How many diabetics end up with amputations? You lose your balance, you start to fall. How many diabetics with peripheral neuropathy are falling and breaking a hip? And if you're not aware of it, a broken hip, in many cases, is a increased chance. The morbidity rates are pretty high. There's nursing home stays that lead to infections, staph infections, MRSA, all that bad stuff. And then you also have, recently you have exposure to COVID in the hospital. So you have a number of things going on that you really don't want going on. Whereas, can you treat neuropathy? Yes, you can definitely treat neuropathy. Um, can you cure neuropathy? I wouldn't say you cure it. You just make the system, a weakened system, operate a little more efficiently so you don't have it. But I'd be more concerned with patients losing balance. You lose balance, it leads to falls. Falls lead to broken hips. Broken hips lead to nursing home. Nursing home leads to not getting out of the nursing home. So there's a lot of stuff going on there. So the question is, should you not take a statin? I mean, it really probably depends on how many medications you're on. But it's a topic like this patient, because I'm not going to take the patient back because I will not be able to make a difference in her life if she doesn't stop taking the statin. I mean, if her cholesterol is 140, so doctor, great, your cholesterol is low, but what are the other 9 pills doing for her? That's the question that I can't answer, but I know my treatment is not effective. And what we do here in Neuropathy Core Health is we use a number of different modalities to get oxygen to the legs, blood flow to the legs, better glucose regulation through certain, diet, exercise, eating properly. And that's kind of in a nutshell. Now we do use other treatments. We use lasers, stimulate production of ATP. We use different laser boots to get nitric oxide production up so you can open up the blood vessels. So the blood vessels will allow greater dilation of blood into the extremity and hopefully take away some of those issues. Another thing to think about too is the nerves do have blood supplies as well. So if the blood's not getting to the nerve can't tell the body part what to do as well. So the whole cavalcade of things that happen when you take statins and you have peripheral neuropathy, but it definitely makes our job that much more difficult, way more difficult to do. So, question is, should you or should you not take a statin? You need to go over that with your doctor. If you have neuropathy, the doctor puts you on it, and you have to ultimately advocate for yourself. Because the safest thing the doctor says, whoa, statins are great. They should put them in the water, like fluoride. Well, guess again. You probably don't need that many statins, and you should use them judiciously. If your cholesterol is through the roof, listen, you have high blood pressure, you take high blood pressure medication, good. Let's bring it back to normal range. You don't want to take massive amounts of high blood pressure medication that's hypotensive. So that happy medium is where we need to try to spend most of our days in, the daily life, where you don't spend your days up the roller coaster or down the roller coaster, you spend that time in the middle. So I think it just needs a common sense approach. If you do have symptoms of neuropathy, you should be working on your diet, which supplements help. There are supplements that help, and you should find some way of treating it where you're going to make sure that the nerve is being stimulated properly. It has the ability to sustain the resting membrane potential without altering that, because that changes the way the nerve functions. I won't go into nerve potentials or action potentials with nerves, but you need to know, very, very important to maintain a healthy homeostasis. And quite often, well-meaning medical professionals will say, hey, take this pill. You're healthy. Taking a pill does not mean you're healthy. Taking a pill is like a crutch. There's times you need a crutch, and there's times you don't. So hopefully I've answered some questions about why statins can greatly interfere with peripheral neuropathy, which neuropathy being I would call it a comorbidity to diabetes, alcoholism, toxic exposure, and chemotherapy. But it's up to you to figure out what you need to do to safely navigate these waters, because neuropathy, I'm concerned about your balance. You're concerned about the pain, that feeling in your feet, and it's not a fun feeling. And chances are the Lyrica, well, you'll gain weight. So you gain weight, but your cholesterol is good. Guess again. So the question is, are you going to be a good enough advocate for yourself to question, do some research, and figure it out for yourself if this is really what, if you're having it, how do you help yourself? Take responsibility for your own health, because the pharmaceutical answer is, hey, take another pill. What's 7 if you're taking 6? What's 7 if you're taking, the more the merrier it seems. And it doesn't have to be that way. If you open up your medicine cabinet and you see a bunch of pills in there, it doesn't mean you're healthy. it means you're working on your numbers, and that's good. And that's not a blanket statement against all kinds of medication. What it is it's raise your awareness. Um, if your diabetes is self-inflicted, what are you going to do to get out of it? What will you do? What steps will you take to help reverse your diabetes? You need to do your insulin management. Good. Be good about it. You need to stay away from sugar. Well, stay away from sugar. So I encourage you to think for yourself, advocate for yourself, and realize that the pharmaceutical, you're an annuity to the pharmaceutical company, especially if you're taking 10 medications. 10 medications is not a picture of health. And if you're in that realm and you're not willing to question, well, then enjoy your neuropathy because there's nothing I can do to help. But hopefully, you'll raise your awareness. You'll start to see the results, start to live better, have better balance, more exercise, and basically more quality to life. If you notice, if you're taking 10 medications, I can't imagine how great the quality of life is. And again, go back to, I'm sure, if you don't know of anybody, ask someone. If you ever heard of somebody getting taken off all medications and they thrive, I've seen it enough times with 30 years of practice. Now, I can't take you off the medication. It's up to you and your doctor. Be a good self-advocate for yourself. And if you have any questions, you can reach us at 203-656-3636. I'm Dr. Brian McKay from Neuropathy of Core Health, located in Darien, Connecticut, 551 Post Road. Give us a shout, 203-656-3636. I'm more than happy to answer any questions. And if you don't live around here, I can refer you to other doctors who actually can help you with your neuropathy as well. All right, take care. Have a great day.